Thank you very much for joining this event of the Red Summit, which is taking place yesterday, today, and tomorrow, organized by the Solferino Academy on behalf of the Federation in cooperation with the ICRC. Thank you very, very much for joining us this evening. This event is organized by the Kenya Red Cross, Cruz Roja Mexicana, Philippine Red Cross, Roja Costarricense, and Magen David Adom Israel. Thank you all the organizers for being with us today and your important contributions. It's a pleasure having you with us. And Itamar, if we can have the next slide, please. We have a distinguished list of speakers, but before we go to the speakers, I have to say a word about the ambition. Why are we doing this event? The pandemic put all of us, national societies that operate ambulance services, and then during this session, we will refer to the ambulance services under the term EMS, Emergency Medical Services, under a unique situation. For ambulance providers, putting their lives in harm's way is nothing new. This is what we do on a daily basis. But suddenly we were in a situation where this was an imminent threat, a new situation that we have never faced before, with a lot of pressure from family members, friends. Please don't go. Don't go to do your job, and job for volunteers and for paid staff is the same. It's the job. It's the job of saving lives. And still our staff and volunteers did it. Did it day in and day out, putting their lives in harm's way. We know that some national societies lost colleagues. So I would start this event with your permission, with a moment of silence to honor and respect our colleagues who lost their lives, saving the lives of others. Thank you very much. So, in a more positive note, or happier note, this session, which is going to be an interactive session, so please feel free throughout the session to put questions in the chat. We will give time for questions and answers, as well as to your feedback during this session. So please bear with us until then. And we will start by having national societies telling the story of almost 2 years of dealing with the pandemic within the Red Cross movement, national societies, operating ambulance services. I'm Chaim Rafalovsky. I'm the disaster management coordinator of Magen David Adom Israel. I've been with Magen David Adom since I was 15 years old. It was many, many years ago. I have more than 30 years of service. In Magen David Adom, I think Isaac is the only one who has more years of service than myself. Thank you so much for being with us. I'm honored and privileged to be your host tonight. And without further ado, I would hand over this session to Ms. Suzanne Nagonga from Kenya Red Cross. Suzanne, over to you. Suzanne? Suzanne, can you hear us? I will just check. Susan, can you hear us? Yes.
Yeah,
please.
You can hear me?
Loud and clear. Please go ahead.
Okay. Okay, good evening and good morning to all of us, depending on which part of the world we are in at this time. So my name is Susan Ngonga. I'm the Managing Director for Emergency Plus Medical Services, which is the ambulance service that is owned by the Kenya Red Cross. And I will take you through our experiences of COVID-19. We'll talk about the main activities, the lessons learned, the challenges, opportunities, and the recognition of our heroes or staff. Next slide, please. So EPLUS is the largest private emergency medical services and pre-hospital care provider in East and Central Africa, with 128 fleet of superior, fully equipped state-of-the-art ambulances manned by highly qualified paramedics and experienced in pre-hospital care. It is fully owned by the Kenya Red Cross Society, and we started operations in the year 2010. We operate both Land Cruiser and HEAS ambulances equipped to the standards of basic life support and advanced cardiac life support. Next slide. So on the COVID situation, on the 11th of March, when WHO declared COVID-19 a global pandemic, with the first case of the virus being reported in Kenya by the Ministry of Health on 13th March 2020, that is the first time we experienced our first COVID case, positive case in the country. And as EPLUS, we advocate for strong emergency services in all phases of disasters and pandemic management, preparedness, response, and recovery. And as a result of this, we set up an internal task force to make necessary plans to respond to the pandemic. Next slide. In terms of our preparedness, we set aside designated ambulance units to handle COVID-19 cases. As you're aware, this virus was mysterious, and because the ambulances were serving all our clientele, both COVID-19 and the non-COVID-19 patients, we had to make sure that we had designated units to use for the COVID-19 cases. We had to procure the necessary PPEs and also build capacity by training the crew on donning and doffing and equipping all the ambulances adequately. We also went to the extent of procuring infrared thermometers for thermal screening and also to enhance infection control and prevention. We had training sessions for all our paramedics in preparation to respond to COVID-19. Despite the trainings, when we had our first case, it was interesting because nobody was really prepared to go for it. Increasing our paramedic personnel, we also invested in disinfection and decontamination process, and we had a clear communication plan that was creating awareness of the COVID-19, both online and on mainstream media, also giving constant update of the operations internally. So the Ministry of Health reached out to EPLUS to provide 15 ambulances to support mitigation and response to the pandemic cases in Nairobi. And to this, we also had the National Security Agency, which is the National Intelligence Service, reaching out to us requiring 10 ambulances to support the security agency in contact tracing of people, especially within Nairobi, which is the capital city of Kenya, and its environs and evacuation to the quarantine and isolation centers. You will agree with me that in the beginning, there was a lot of grayness about this virus, and I mean, the government was just trying to do all it could to try and contain those who were exposed already so that we avoid much more exposure. And we continue to carry out COVID-19 evacuations today from all over Kenya and also on behalf of the Ministry of Health. Next slide. Next slide, please. So our main activities involve sharing experiences and addressing challenges through peer-to-peer discussions. And we also enhanced our continuous medical education. We also ensured that staff were equipped with proper PPEs and continuous training on donning and doffing. Maximum reduction of risk to personnel. We did this by practicing high level of infection prevention and control measures, and also ensuring strict adherence and monitoring to compliance. We had daily debriefing and psychosocial support to the staff and prompt response to emerging issues. We participated in webinars and finding relevant fact-based training for our staff to equip them with adequate information on COVID. Next slide. We also worked closely with the Ministry of Health to evacuate confirmed cases, doing contact tracing, and movement of identified contacts to quarantine areas. We supported in screening in some counties and participated in the sensitization and awareness creation in the community. We had rapid response teams in sample transfers. We facilitated rapid response teams in sample transfers to laboratories for testing. And we had paramedics trained as well on critical care, participating in joint training to support health workers on case management in critical care units. We also ensured that we had real-time data capture and sharing of national trend monitoring. Next slide. So in the early stages of COVID-19, there was little or no information on the pandemic, and this led to quite a lot of apprehension and fear in terms of handling the COVID-19, even amongst our own staff. We had difficulties in acquiring PPEs and other related consumables from foreign acquiring this from foreign suppliers proved tough due to the global lockdowns. And those that had the PPEs in country, the prices were highly inflated, making it very difficult for us to acquire. However, we invested in stocks before, and we just tried to make sure that we used these stocks that we had sparingly. There was also stigma for our crew members from the members of the public due to misinformation of the pandemic. And in the beginning, we also had stigma from our own crew when the first crew members went out to do the first case. And we did a lot of sensitization to the staff for them to understand that, you know, this is a call for duty, and they have all taken the Hippocratic oath. And so it was time for us now to show what we are made of in terms of the calling that we had to respond to those who needed our services at that time. We also had a situation where some of our staff members contracted COVID-19 in the course of their duty, and I was also a victim of this. I was the most affected in terms of COVID-19 amongst our staff. Next slide. Next slide, please, Itamar.
Susan, you have a delay, it's already up.
Yeah, the other challenges included lack of adequate PPEs, the fear of ambulance crew to respond to positive cases. And during the sensitization, we had to just encourage them. And you can see the picture on the right, where we were also encouraging people to stay at home to make it easy for us to respond to cases. So we had to keep telling them we are at work for them, please stay at home to make it easy for us to serve you. There was fatigue as a result of the many cases that were being evacuated increasing. There was issues of emotional and uncooperative patients. Handling them was not easy. There was traumatic experiences of ambulance crew, especially after handling a COVID-19 patient, and also considering that most of them were going back to their families after handling these cases. We also had a challenge of poor coordination at the Ministry of Health level. They were not very well prepared. The receiving facilities were also not well prepared in the beginning. Next slide. So despite the challenges, there were also opportunities that arose. And we had opportunity to do contact tracing in conjunction with the government of Kenya. We also had opportunity for screening of public at designated public areas like the malls, recreation facilities, etc. We conducted psychosocial support for the staff and their families. We did lots of trainings to the paramedics and EMTs on COVID-19 swab collection to support the testing by the facilities that were doing COVID testing in the country. And due to our large fleet, we were also contracted by the ministry to handle evacuations of the confirmed cases. We had opportunities to learn e-learnings. We participated in No Fear Project webinars. We had a number of virtual forums. There were DEM virtual forum, and these enhanced our capacity to respond better to the COVID-19 pandemic. Because of the apathy towards using ambulances and going to hospital, we set up a telemedicine service called EDOC, which is an online virtual medical consultation where patients were able to access a doctor from wherever they are for general consultation and non-emergency related cases, because visits to hospitals had declined because of fear of the unknown. Next slide. So in terms of the lessons learned, there was increased demand for more and adequate supply of protective gear for the staff in the front line. And this now has become a norm that we must have enough stocks of PPEs at all times for any infectious diseases or that we would be handling or cases. High demand for psychosocial support for the ambulance crew due to the uncertainty and misinformation. Continuous daily briefings facilitated timely address of key issues of concerns for smooth operations. We had to do continuous motivation for the staff during the pandemic. They were working long hours and they did not have time even to eat. And we had to make sure that their welfare was all well catered for. Group therapy was very important and support for staff affected by the pandemic. And we created a WhatsApp group that people could share experiences and support one another when they were low and not sure of what to do. And also their families were supported through these group therapy sessions. Next slide. I've talked about the PPEs and we have ensured now we have sufficient stock. You can see a picture of our ambulances. We also acquired a portable isolation chamber and on the other side, we had the contamination exercise going on. Next slide. So as I said, we acquired 2 portable isolation chambers from Israel, and thanks to the partnership with Magen David Adom, and this increased our capacity to respond safely, and we also received a further donation of 5 portable chambers from the Swiss government to aid our response, our safe response for the COVID cases. Next slide. So these are pictures of our staff and some of the training sessions that we were involved in. We had a session there for donning and doffing of PPEs. We had CMEs continuous going on. Next slide. We also had disinfection and decontamination process. We made sure that we did not take chance after every evacuation for the COVID-19 cases. And we did the decontamination in phases at the hospital after handover of the patients. At our logistics center, which is the base of our ambulances, we established a decontamination area. And after every 24 hours, we were decontaminating our ambulances to ensure that the staff were safe and were also safe for use for the next cases. Next slide. We had a clear communication plan, creating awareness for COVID-19, and we continuously developed communication content around shared on social media platforms and also on our main media platforms. We participated in TV shows discussing COVID-19 in the country, and we ensured that every week we had activities on both mainstream and social media as a way of creating awareness and supporting government initiative to curb the spread of the virus. Next slide. And those are some of the communication that we shared on mainstream and social media platform. And we have continued to date to develop communication around COVID-19. We have a supplement, a weekly supplement that documents our pandemic journey. And this is uploaded on our website and shared to all our clients using our customer relationship management system. So those are some of the communications that go out, and the supplement is also on the right. We do it on a weekly basis. Next slide. This is content on social media. Also educative information to the public, creating awareness. Next slide. This is also some of the information shared on social media, and we have our staff there being very proud to serve, telling our clients to stay at home so that we can serve them better. Next slide. Yeah, so it was a whole year of quite tedious work, and the staff went out of their way to do quite a lot of work. We had sharing ceremonies with them. We had awarding ceremonies, just celebrating them because they were our heroes, and without them, we could not have managed to respond to the level that we did. And with some of our partners, the Kenya Medical Practitioners and Dentists Council, who appreciated the amount of work that the team did, we awarded certificates for extraordinary service and dedication during COVID. We have 2 of our staff members, a paramedic and operator, who have been shortlisted for the most valuable corporate response COVID-19 category in the National Business Leadership Awards 2021. Some of our staff members have unfortunately also contracted COVID-19 in the course of their duty. demonstrating the risk they place themselves while saving lives. And we remained the only emergency medical service provider in this country that could handle COVID-19 calls. And to date, we have handled the highest number of calls in this country. Next slide. The pictures on the right show some of the ceremonies that we have had. And that brings me to the end of my presentation. Open for any questions. Thank you.
Susan, thank you very much for an amazing presentation and for the amazing work you're doing for the people of Kenya. With your permission, we will leave the questions for the end. I failed to mention we are recording this event, so please, if anyone does not want to be recorded, keep your cameras off. And for those who joined, please, on the chat, write to us, who are you and from which national society you are coming. Next slide, Ditama, please. And it's my pleasure to invite Mr. Von Ryan on to talk about the activities of the Philippine Red Cross Heroes during this pandemic.
Thank you, Kaim. So to start, good day or good morning, good afternoon, and good evening to all for participating in our Red Summit event. So to start, my name is Von Ryan Ong. I'm the head of safety services of the Philippine Red Cross. We handle training and EMS in the whole country. So next slide. Just an overview of the emergency medical services in the country. We are one of the biggest provider of pre-hospital care or EMS in the country. And this is a mandate of the Philippine Red Cross being chartered and under the RA or Republic Act 10072 of the Philippines, that we are an auxiliary arm to the government in providing health, disaster, emergency responses. Unfortunately, the EMS system in the Philippines are still a baby compared to other national society, that we are really giving focus in creating and making our EMS as professional as possible with proper standard and equipment, guidance, and scope of practice. Other players from the EMS systems are from private groups, from our local government agencies, down to the level of our community, or we call it barangays. A lot of our ambulances in the country are really not up to the standard of international, and also even for the standard of our nation. That's why we are striving hard to at least make it to be a par to other national society or EMS system of other country. To emphasize the EMS, we have a lot of responses pre-COVID situation on emergency and non-emergency. We provide service to at least per year around 10,000 to 11,000 patients or clients for non-emergency and emergency. We operate as of today, we have 171 ambulances all over the country, and these are being managed by our chapters all over the country also. Next slide. So our effort in our COVID response during this pandemic actually started in March, when our president declared a lockdown for the whole country. That is March 15. And it's very ironic that during that time, we are holding our specialization. So some of the participants actually here were in one island in Bohol, that we might be stranded in that island, and imagine it that all of our chapter service representatives are stranded in one island, and who will manage our EMS in each provinces or chapter. So immediately we cut off our specialization event and let our chapter service representative or managers of the EMS go back to your respective offices to prepare and brace themselves in the COVID response. Then as of today, since March 15, we already catered 981 COVID responses. These are across the country, but we still continues to provide services on the non-emergency or non-COVID responses. As of today, we have around 6,000 runs, and part of that are from the COVID response. Early days of the COVID response, we had an agreement with the Department of Health or our Ministry of Health that they will be the main responder for positive patients. Unfortunately, during that time, there were some back and forth of patients that should be catered immediately to be transported to the facility. And fortunate enough that the Philippine Red Cross step up and provide the necessary service or ambulance service, even though we don't have enough knowledge about the response, equipment-wise, and our PPEs are really sparse during that time. Next slide, please. Because as I mentioned that we are really don't have any knowledge during that time. That's why we are really banking to the guidance of our Ministry of Health, WHO, Magen David Adom, and other articles that we can find that we can verify that is a true studies and guidance. So we created our emergency medical services interim guidelines for COVID operation. This is composed of specific instruction and operation for managing our EMS, to be more specifically, operation of ambulance in catering COVID positive patient. During this time, we conducted also our training and roll out to different chapters. We have, just to mention, we have 103 chapters that are catering to the call for the COVID operation. These interim guidelines gave our responders, our EMTs, EMS personnel, at least a weapon of knowledge and skills that can be used during their engagement to COVID positive. Next slide, please. As mentioned earlier, we have 171 ambulances, and 6 of these ambulances are our negative pressure ambulance. We are very fortunate to receive donation from our partners and other stakeholders to procure 6 ambulances that are equipped with negative pressure system. Also, as Susan showed earlier, a isolation chamber. So we have 6 of these ambulances that give us a better chance of fighting against COVID. And we have at least another layer of protection for our responders and our team. Actually, my usual explanation of the ambulance or the response that we have in terms of protection, we have 3 layers of protection. First is the PPE, the right PPEs for our people. Second, a divider or a non-porous divider between the ambulance crew and the front and the cabin of the patient. Then also we have the negative pressure, meaning the ambulance or the negative pressure ambulance have its chamber, and also the whole chamber is negative pressure also, and using a HEPA filter to make sure that even within the cabin we are safe, and the air that are coming from inside the cabin are also filtered to make sure that we are not transferring the contamination or the infection outside of the ambulances. So just to make sure that you can see or appreciate our negative pressure ambulances, we prepared a video that are shown in our social media or every media that we have in the Philippine Red Cross to make sure that we are ready to support the government in this fight for COVID-19. Can we play the video, Itamar? Thank you, Itama. True in our mandate or mantra that we are always first, always ready, and always there, just to mention that this negative pressure ambulance are the first in the country to be utilized in the battle of for COVID-19. And we take pride for our manpower or our people that mans our emergency medical services. And actually, the whole Philippine Red Cross are composed of at least 80% of our manpower are volunteers. Only 20% are included, like myself as a staff. So the Philippine Red Cross or our EMS will not run as smooth as possible if there's no volunteer that rendering their full-time or part-time to give service to our community. We take pride on their dedication also in providing time, because a lot of our volunteers are also hired or employed to different industry that gives them a hardship to give 100% service. But as we have here in the country, that we really take pride on the bayanihan. We called it a concept, that bayanihan, that it helps other people to lift them from this hard time during COVID. And also to give thanks or recognition as early with Susan, a recognition for our heroes, our volunteers and EMS crew. We also have a video prepared to showcase to our community what is the essence being a EMS personnel in the Philippine Red Cross. So I have another video. Maybe Tamar, can we play also the video in the next slide?
Hi, I'm Vanna Diwa and I work in the hospitality industry for 14 years now.
Ako nga po pala si Ian Charles Martin Lopez. Isa po akong registered nurse at emergency medical technician.
Ako po si Michelle Galangin, isang Army Reservist.
Ako si Raymer S. Torres, isang law student.
Ako po si Marben Pareha. Graduate po ako ng Food Service Management. I'm Brian Del Ponso. I work in the engineering field and I'm a safety practitioner. I joined the Philippine Red Cross EMS because of my desire to help others in any way I can.
I joined the EMS because back in 2015, nagkaroon na medical emergency yung father ko. And that's when I realized the importance of first aid. And first aid could really save lives.
Pinili ko maging EMS personnel kasi isa itong pribilehiyo upang makapaglingkod at makapagsagip ng buhay ng kapwa nating Pilipino.
Masaya sa feeling pag nakakarinig kami ng thank you sa mga nare-response namin ng mga patient.
Natutuwa po ako na nakakatulong ako sa ibang tao kapag nagpapasalamat yung mga natulungan namin, mas masarap sa pakiramdam.
I am Raymer and I am an EMS personnel.
I am Ian and I am an EMS personnel.
I'm Brian Del Ponso and I'm an EMS personnel.
Ako po si Michelle Galangin at ako po ay isang EMS personnel.
I am Vanna Diwa and I am an EMS personnel.
I am Marvin A. Pareja and I am proud to be an EMS personnel.
Thank you. In addition, just because of the scares of the COVID-19, we actually put some level of other protection to our manpower. I don't know if I'm the only one that I can only see the slide, our manpower. Tama? Okay. Protecting our volunteers. So, to protect our EMS personnel or our responders or frontliners, we allocated or we prioritize the vaccination or full vaccination of our team members. And actually, we have our own molecular laboratory in the country. The Philippine Red Cross have now 13 molecular laboratories that are actually producing 25% of the testing in the country. And this is at part of our government laboratory. We already tested around 3 million to 4 million testing for the whole country in terms of COVID-19 infection. Then because of that capacity, we are subjecting our volunteers and staff in the routine testing for every 2 weeks to make sure that we capture every individuals that may have already contacted or infected with COVID-19. And once we detected detected a personnel that is already COVID positive, we are transferring them to our isolation facility. When I say our isolation facility, the Philippine Red Cross, in partnership with our local government, local schools, created several isolation facilities that could cater to the public and also our staff and volunteer. These are completely in the efforts of the partnership and donation of our stakeholders. Also, because the isolation facility can only cater to a asymptomatic patient, but we have several cases that it progressed, the infection or the condition of the patient progresses to a more severe case. We partner with our Philippine Lung Center. We established a emergency field hospital that can cater at least 80 to 100 critical patient that requires a higher medical support for COVID-19. Next slide, please. Addition to that, we provide provision of vitamins for our team to make sure that their immune systems are high and can fight against the COVID along with the vaccination that we did. Also, we extend support to our to our volunteers, to their family members by providing the same service, swabbing, testing, provision of isolation facility if they were tested positive, and similar provision of hygiene kits, quarantine kits are being provided to their loved ones. Then next slide. This just to give you a numerical value that this is our accomplishment for the year within as of this week for the total runs and total service that we provide. We catered patient 5,323, transported patient 3,208, and we treated patient 2,215. Then for COVID-19, for this 2021, we already catered to 655 individuals transferring to our facilities and hospitals. Then just to emphasize that this effort will not happen if the collaboration between the government and the Philippine Red Cross and other stakeholders and the initiative of our leadership in initiating a better response for COVID-19. So with that, I'm ending my presentation. Thank you for listening.
Thank you very much, Von. I would just mention that not to forget that social distancing, hygiene, and wearing masks are our first line of protection, always and everywhere. And I know that the Philippine Red Cross is very strict about those measures. So thank you very much. And without further ado, Cruz Roja Costarricense, por favor. Adelante, Christopher.
Thank you very much. Christopher Calderon. I work in the Costa Rican Red Cross. I work in Department of Standardization of all the procedures in the operative field, talking about pre-hospital care and rescue. I'm going to talk as an abstract of what we do or what is of our experience and activities attending COVID-19 emergency. Next slide, please. This is our website. You can visit it. It's in Spanish, and our theme is mobilizing the power of humanity. So there's a website that you can visit and learn about Costa Rican Red Cross. Next slide, please. We have a total of emergency incidents that enter our 911 emergency system and transfer the calls to the Costa Rican Red Cross. We can see a difference from year 2020 to this year 2021 of an increase of incidents, okay, and also COVID related. So this is the total of incidents that enter the Red Cross so we can distribute or attend COVID. Next slide, please. This work is the people in charge of this hard work are dispatchers. We have a central dispatch and regional dispatch that help filtrate what calls we should go and what calls can be attended at home or by phone to maximize our ambulance resource and manpower resource and exposure. So this hard work with procedures with our dispatchers is they're a part of our front line, and they are very important to maximize our resources. Next slide, please. Here is some data of what happened this year. The last slide, we had more than 68,000 COVID-related incidents, but we've only transferred 39,000 people. So our dispatchers are trained and to help maximize our resources. And we have different data of age, our provinces here in Costa Rica, and by category of transfer. We've had people who have deceased in our ambulance, and we have locally a minor of red category incidents transferred to the hospital. We've had upgrade or increase in patients by critical patients, but most of them are low category or stable patients. This is by the prevention and communication of our government and of the Red Cross to help reduce propagation and help recognize when you should occur to a medical service. Next slide, please. So what do we do in Costa Rican Red Cross? Well, the pre-hospital attention is one of the main actions during COVID, going with the ambulance, with a basic life support ambulance or advanced life support ambulance to help our community. But also the prevention programs and the education programs of help to disseminate, help to educate what's about COVID and how to reduce the propagation, like James said earlier, okay? We have a transfer agreement with our local or our National Committee of Emergency.
Christopher, we lost you for a minute.
Okay, I think I'm back.
Yes, you're back, and we lost you with the transfer agreement.
Okay, our transfer agreement is with our National Emergency Committee, that every patient who has need to be assisted to a medical service, or after they leave the hospital to their house, we have an agreement to translate or transfer these patients in our ambulance, okay? And we get payback to help contribute to our resources and PPEs, etc. In Costa Rica, there's an emergency operations center, and the Red Cross is one of the most fundamental members in making decisions and strategies to prevent, to mitigate, and to treat every Costa Rican COVID related. Okay, so what Costa Rica Red Cross helps is with the manpower, with the ambulances, with the resources, with our preventing programs and education to help all of our Costa Ricans and all of our social national Red Cross members. So this is very important, since with the government, we work hand by hand to help everyone with COVID, okay? Next slide, please. So how we do what we do in the Red Cross. Next slide, please. It's just not attending the normal situation or emergencies, okay? But COVID specific related, we have procedures to how to treat the patients, procedures to how to put on our PPEs, procedures to how to dispatch. We have a lot of procedures, okay? So everybody can have the same language, same treatment. And what we do is train also our personnel to help mitigate and to help put on their PPEs so we can be the safest possible, okay? We have a big distribution of PPEs nationally, okay? Also, every committee in the Red Cross has their own backup of PPEs. So we're just a big Red Cross as a national society to helping each other and make sure our first theme is to stay safe, okay? Next slide, please. we've been on news, okay, with history or people or personnel having their own complications, all their own family emergencies. Next slide, please. And also to show to the Costa Ricans what we do, how we do it. So this program or this news helps sensibilization of the patients and of the people to the Red Cross and see the importance, what we do, but mostly of the prevention of the disease. Next slide, please. Also, we follow up of all of our members, all of the levels to see what are they doing, how are they doing it, even though there's procedures, and also make sure they're staying safe, and if they require anything else, or is there anything different, anything new that we should know and help them out. Next slide, please. There's this one main theme of vaccination. The Red Cross helps our social security system to distribute the vaccination, to distribute the personnel so they can go to the communities and vaccinate everybody. We provide our manpower and our ambulances to help the national vaccination program. Also, all of our personnel are required to be vaccinated to provide medical assistance or to provide help any way in any matter of the Red Cross system. Next slide, please. So always Costa Rica, beaches and mountains and all that. So be safe and save lives. It's very important for us. And as Red Cross, we help our community and we help our own members to prevent and to stay safe. Thank you very much.
Thank you very much, Christopher. Next slide, please. And as I said, my name is Chaim, and I will present the Magen David Adom response in Israel. Next, please. Magen David Adom is the National Society member of the international movement for the State of Israel, and as such, we are auxiliary to our defense forces and public forces in cases of emergencies, and Israel is under a situation of emergency for the pandemic starting in March 2020. We operate the National Blood Bank. I'm not going to talk about the blood bank, and we are the national ambulance provider on behalf of the state. In Israel, there is only one public ambulance service, EMS, and that's Magen David Adom. And in this operation, I would say it's a wonderful mix of our role as auxiliary to the public powers in the case of a national emergency with the capacities of an EMS. Next, please. When it comes to the human resource, we are around 3,500 staff members with a huge group of volunteers, more than 25,000 active volunteers in our ambulance service, in our EMS. Some of them are acting as first responders with motorcycles, equipment in the trunk of their private car. Also, we have some volunteers on bicycles, as people doing volunteering as life guardians, a unique program for resuscitation. And I would like to mention how proud we are to be representing all the groups in the Israeli society. And in the image, you would see an ambulance crew in Jerusalem where you have a volunteer, an ultra-religious Jewish volunteer with a staff member who lives in Judea and Samaria, and Fadi over there, who back then was still an EMT, now is a paramedic, senior paramedic, who is from East Jerusalem, a Muslim from East Jerusalem. For us, it looks like the most normal thing in the Israeli society, I would say. It's not that much. Next slide, please. When it comes to the operations, we have more than 500 motorcycles and bicycles and more than 1,000 basic life support and advanced life support units. The important thing is that in 2020, in I would say 9 months, because this statistics is of September, we did more phone calls than in year 2019. And the dispatches have also increased both for COVID cases, but also for non-COVID related emergencies. In Israel, we don't have a 112 or 911 system. So we operate our operation center, as you can see on the map. Next, please. And for the first time, we found ourselves involved in many activities which are not directly EMS. So we had to educate the public. And one of the challenges, very unique to Israel, I think Susan will smile now, also the colleagues in the Philippines, is talking with people, Muslim people who had to celebrate twice Ramadan during COVID. And Ramadan is a family time. You fast during the day, but in the evening you have the iftar, the famous dinner where all the family sits together and eats and eat. And we had to talk with people about how to have a safe Ramadan. We had to talk with people about stress, about being in isolation, about being alone, how to deal with quarantine at home, how to deal with isolation. You see on the image collecting what is called convalescent plasma from people who recovered from COVID-19. And that at that stage was one of the only ways to treat critically ill patients. And we were tasked to vaccinate people. And we had to outreach with vaccination. So we set up special mobile units to go and vaccinate. And we are extremely proud that Magen David Adom was tasked by the government to vaccinate all the people staying in long-term care facilities, where we would outreach to those people and vaccinate them. And we are very proud that at the very beginning of the vaccination campaign in December 2020, we managed to vaccinate all the elderly population in Israel and people in long-term care facilities within 3 weeks. And then after a month, do the same in 3 weeks for the second dose. We are doing testing. And testing means you need to outreach to the community. So you can see here a container that was developed by Magen David Adom that you put in the middle of a neighborhood that are underprivileged. They don't have cars. So you bring the testing to them. You don't ask them to get to the testing centers. And on the EMS, of course, we have challenges. Vaughan mentioned putting a patient behind a barrier is a challenge, and people from suffering from COVID have a very unique disease and they might deteriorate very fast. So we have now a very sophisticated system where they're connected to a monitor, and our medical control, national medical control, is watching the screen and giving an alert to the team in the ambulance if they see something which is abnormal. And we have this bus that we thought we will never use, and we ended transferring people who were tested positive for COVID from elderly homes to another geriatric hospital for COVID patients. And this bus allowed us to transfer a numerous number of people at the same voyage and not one by one in an ambulance. Next, please. In the figures, you can see that we took more than 5 million samples, and now we are doing rapid antigen tests. So, so far, and this is something very new, it's basically 2 months old, we did more than almost 1.5 million rapid COVID tests. We delivered more than 1 million vaccines, and so far, in the 2 years of the operation, transferred more than 31,000 people that were confirmed with COVID or suspected COVID cases to healthcare facilities and back from hospitals to long-term care facilities because there are no other means of transportation. Next, please. But this is the most important thing. Without those people, we could never have achieved what we did. Itamar, the video. I think the video speaks for itself. This is my Director General, Mr. Elitin. Who was answering also phone calls. Next, please. So what have we learned? That our staff and volunteers are our true power. I can talk about technology, I can talk about everything. Nothing would have happened if the staff and volunteers would not have showed up day in, day out, doing a remarkable work under the worst circumstances we could have imagined. We realized that during COVID, one of the main issues that we all see is trust. People need to trust us that when we are taking an uncomfortable test like the swab test, when they go to quarantine, they need to understand why it's important and that we are communicating truly with them, and of course about vaccines. And the fact that our volunteers trust us and communities trust our volunteers are in Israel key determinant in the success of the COVID operation. Those we like to call them, call ourselves a grassroots organizations, the boots on the ground, but they are the people that they trust. And it's amazing how people talk to you. And in the end, they, after an hour of discussion, they look at you and say, I trust you. I will do whatever you're doing. And our volunteers are doing that. One of our most remarkable programs is Fadi that you saw there. With his volunteers have this challenge for the volunteers, which is called a family discussion. And he tasked his volunteers, you have to manage a conversation with your family once a week about COVID, vaccination, measures, etc., etc. And we see how those families are being vaccinated, how the grandparents who not always understand the technology, but they look at the eyes of their granddaughter and say, you're smart, you're a smart young lady. If you think it's the right thing to do, we will do that. And for me, that's amazing. And of course, this is what, in real terms, what is community engagement and the impact that our volunteers have there. We are playing a new game. Everything we have discussed so far about risk communication, emergency communication, yada, 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 doesn't exist during the era of social media. You can have the best communicator on media, and while that lady or that man are speaking, someone is tweeting or putting on Facebook, that person is full of BS. And what people will remember is the comment about BS and not what you managed to communicate. I think that we need to rethink how we improve our presence and the way we combat, and that's my word, we combat misinformation and malintentioned information on social media. We need to better understand our communities and what are the root causes for their behavior, especially when it is a negative behavior, like not getting the vaccine, not being tested, and how we address that in order to be better prepared and better meet their needs and achieve our goals. Can we do a specific community tailored response? You see there, Magen David Adom working in Arab communities. I can tell you one of the challenges was that during Ramadan, we realized that people will never get vaccinated or tested during the day because they are fasting. So we switched our whole operation to do it overnight. So in this case, yes, it's 18% of the Israeli population. So of course we will do that. When it is one community, what is our capacity really to tailor-made our community response? I think that's a challenge that we need to discuss, and of course, effective risk communication. Already mentioned. Next slide, please. So before thanking you, people are recognizing the work of Magen David Adom. I think you have all seen that image. It's a crew of Beersheba, from Beersheba, an ultra-religious Jew, an ultra-religious Muslim. They work together. They're the team. They are used to work together every morning at about between 8 and 10 a.m. They ask for a short break for their morning prayers. The Jew is facing Jerusalem, that in Beersheba is to the north, and the Muslim Mecca, which is in the south. This is why they are back to back. They didn't know that the third team member is taking the picture and became emblematic. And the other thing is that the recognition that we received, that is really heartwarming. And it was in the very beginning of this pandemic, the city of Jerusalem decided to illuminate the walls of the old city of Jerusalem, stating Jerusalem salutes Magen David Adom, which really shows the recognition of the people, of the common people, the public, to the hard work that our volunteers and staff are doing on a daily basis. So thank you very much for listening, and I'm handing over to my brother, Isaac, hermano Isaac, Cruz Roja Mexicana, por favor.
Thank you very much, Chaim. Can you help us with the translation in English?
So good morning, evening, and night to everyone that's here with us. First of all, we have to say that Mexican Red Cross works like a private auxiliary institution of the Mexican government. And we have working in the front line of 45,000 of volunteers these days. We have 545 headquarters all over the country. And we want to mention what we do. Like we have several areas to working with, but one of the most important we have is the emergency medical services, like the EMT and the relief area. We have people that has all over the training to respond to these areas. We have the resilience area, the EMS school or training, and the next slide, please. So our first steps to working in the pandemic, it was the coordination meeting and identification of the needs. In the Mexican Red Cross, one of the principal headquarters, we have all the coordinations areas. They have a meet at the crisis center, and they define the actions that has been followed by the Mexican Red Cross, how we have to work during the pandemic. Next slide, please. So they identified 3 steps, 3 priorities. One of them was the information, how we have to let know all our volunteers and all our workers what was happening in the moment. The second one was the training. We have to train in 2 different areas. One with our volunteers, we have the biosafety training. And the second one was the sensibilization of the Mexican population, how was going to work the Mexican Red Cross during the pandemic. And the third one was the protection of the personnel. It was hard to work at the beginning of the time with the same suppliers of the Mexican Red Cross, because all the materials and the suppliers were lower due to the offer and demand in all over the world and in all over Mexico. Next one, please. One of the most important thing we have is that the engineer system works in the CTREP project. It was a project to send the information to all over the country in one central base. We have daily reports about the confirming cases, the number of patients we help. Now these days, until now, we have 455 national reports, and this starts in May of 2020. We generate an inclusive pandemic national reporting system. That's the CTREP project. Next one, please. Now we have the numbers that they are like the most important thing. We have, since the beginning, the COVID cases of the pandemic in Mexico, we have 3,732,049 COVID cases confirmed until now, until today. And we have these numbers. We have 1,329 ambulances all over the country working in the front line, not only with COVID cases, also with the during daily emergencies. We have 1,911 paramedics working with COVID cases daily. We have chapters response, like they're like the headquarters in Mexico. All over Mexico, we have 40,030 headquarters working until now. We have one issue during the pandemic, because only 3 chapters or only 3 headquarters have to close due to contamination. Now today they're open, but we have only that's the issue with the pandemic, during the pandemic. Like in the past slide, I told you, we train 9,172 biosafety paramedics. They have that course, they have the training, they know how to work during a COVID case. And also we have nurses and doctors working from the Mexican Red Cross that are also training. We have ambulance transfers, not only with COVID cases, also with, like I told you, the daily emergencies we have in Mexico. We're not the only one service in Mexico that provides the EMS service. And well, we have the number 2. We have the confirmed personal contaminated COVID case, like 882. We have also, unfortunately, numbers of deceased volunteers due to COVID. We have 38 volunteers. And also we have an issue with in Mexico with the Mexican population, that we have personal attack related to the pandemic. 37 personal attack here in Mexico. All of our, it's important to let you know that all of our ambulance transfer are all free. We don't charge for that. So that's important to let you know. And also in our numbers, we have starting the pandemic, all volunteers decreased. You know, the personnel that are volunteer in the Mexican Red Cross decreased because they don't want to attend all the COVID cases. So that's another important thing to say. The next one, please. So during the pandemic, we have emergency medical services, and also the Red Cross has good to work with another institutions and helping them with the hospital extension. Two of them, one, it's the National Institute of Respiratory Diseases, the INER in Spanish, and the regional hospital in Acapulco. So we have installed hospital extensions. They are today working 100%. And also we help with COVID testing hospitals. We have three. One of them is here in the principal headquarters, the Hospital Red Cross of Mexico City. We install in Host Market all over the country, and in the National University. We have only one of COVID testing hospital. We'll still keep helping with this community, with the EMS services, and we set up with a COVID testing hospital. The next one, please. One of the consequences, or well, three important consequences we have during the pandemic or the response to the pandemic, there are the misinformation of the people that don't let the volunteers to work correctly. We have stress, we have violence with our volunteers or paramedics. We have discrimination. One of the several cases we have that with uniform or volunteers couldn't eat in some restaurants or couldn't go in several public places because they had the uniform of the Mexican Red Cross. They couldn't buy in some stores when they have like the Red Cross. And fortunately, these cases have been decreasing. And we have also the other face of the coin, like we say here in Mexico. We have all the support with several companies like Uber, like Airbnb for volunteers to let them travel one place to another. For example, Airbnb help our volunteers to stay in the place and not to go back home and maybe have that risk with our family. And the next one, please. Finally, we want to recognize, we're so very thankful and we appreciate all the work that our volunteers make all over the world, in the Mexican Red Cross, and the Red Crescent and the Red Crescent movement, and their families, because all the support, like Chim said, wouldn't be the same if we don't have the volunteers for the work and the courage in facing this pandemic. It was all new for us. We didn't know about a thing. We work all over with baby steps, and we work together for helping the humanity. And we finally, our numbers have 98% of our volunteers here in Mexico already vaccinated. We're still working with supporting our government with the vaccination campaigns with all the Mexican population. So now these days we're working good and we're getting safe.
Thank you very much, Kai.
Thank you very much to you for an amazing work and amazing presentation. Thank you so much. And wake up everyone, for all those who fell asleep, because we were talking for so long. With your permission, we will take some few more minutes. And now it's the interactive part. So we will share some questions with you, and you will be requested to answer them. Idama, please. So, Idama, we cannot see the voting, or it's just me because I'm a co-host? Von, can you see the voting option on the screen?
Yes, there's a poll option.
Okay, so please, exactly 20 seconds to answer. Were you trained for using PPE during the pandemic? Yes, face-to-face. B, yes, virtual or remote. C, no. 20 seconds to answer, and we will see what are the results of our poll. So please, we see who is not voting, guys. And you know, we don't like people who fall asleep while we are talking. So 5 more seconds for the voting. Itamar, can we see the results, please? Or you will read them to us if I cannot see them.
We can see it, Tim.
I cannot, so Von, if you can read for
yes,
me.
Option 1, yes, face-to-face training is 44%. Yes, virtual or remote training is 44%, and no is 11%.
Mathematics doesn't end for me, but never mind. It looks like we did well, and we managed to train 88% of our people in use of PPE, and at least half of them in face-to-face with all the risk. Sounds great. Next, please. Have you been treating or transporting COVID-19 patients? A, yes, severe cases as well. B, yes, but only mild cases. C, no. Again, 20 seconds for your answers. Christopher, I would ask you to read the results of this question.
Okay. Have you been treating or transporting COVID-19 patients? We have 29% yes, severe cases as well. 41% responded yes, and 29% responded no.
So the work that people are doing is incredible. 50% and more of the people really not just trained, because you know in disaster management we often train people and they do nothing. At the end of the day, people really responded to patients, and that's important. And if they were trained, that's good news for us. Next, please. Were you involved in sampling and testing for COVID-19? A, yes, I sampled and tested patients or tested patients. B, yes, I supported sampling, which means I did not take the actual test, but I did logistics, call centers, etc. And C, no. Mexico Red Cross, that goes for you.
Okay.
We will give people 4 more seconds to answer. And please, go ahead.
So were you involved in sample and testing for COVID-19? And 17% answered yes, I sample or tested patients. 61% yes, I support sample and testing. And 22% no.
So 80% of the people present here were actually involved in COVID response operations. Wow, multiply that by the millions of volunteers that we have in the movement, you see what an amazing work our volunteers and staff did during the pandemic. Itamar, next one, please. Were you involved in vaccination? A, yes, I administered vaccines, I vaccinated. B, yes, I supported the vaccination campaign. Again, logistics, call centers, and C, no. Von, I would ask you to read the results of this question.
Sure. Okay, so you're involved in the vaccination campaign for COVID-19. 17% answered yes, I administer vaccine. 72%, yes, I supported the vaccination campaign, logistic call center, etc. And only 11% for no answer.
Again, people were really, really, really engaged. Next, please. Did you feel safe during your response? A, very much. B, yes, pretty safe. C, sometimes I felt at risk. D, most of the time I felt at risk. And Susan, I will ask you to read in 20 seconds more your answer. That's a tough one. Susan?
Sorry, I can't see the screen. I'm waiting for the poll. Okay, so did you feel safe during the response to COVID-19? 11% said very much. 11% said yes, pretty safe. 67%, sometimes I felt at risk. And 11%, most of the time I felt at risk.
I have to say that I'm surprised on the good side of the surprise. I thought we would be much higher on most of the time I felt at risk. Let me say that if someone did not feel scared during the pandemic, that's an interesting question. Why? Because we were all dealing with something new, something we didn't know. I felt scared numerous times. So I would say B or C. So yeah, it's a natural reaction that we should all recognize. And the last one. To what extent did you feel supported and provided with information during the response to COVID-19? A, I felt very much supported and provided with the needed information. B, most of the time I felt supported and provided with the needed information. C, part of the time I did not feel supported and provided with the information. And D, most of the time I did not feel supported and provided with the information. And I will ask Susan again to provide the feedback on this tough question. We will give people some seconds to think about it, and then we will show the results.
Okay, to what extent did you feel supported and provided with information during the response to COVID-19? 50% said, I felt very much supported and provided with the needed information. 44% said, most of the time I felt supported and provided with the needed information. 6% said, part of the time I did not feel supported and provided with information. And 0%, most of the time I did not feel supported and provided with information.
Wow. I have to say, wow. An amazing answer and here goes my heartily thank to all those who spent nights, especially nights, preparing those communication for staff and volunteers, preparing the guidance, talking to them. I have to be honest, sometimes it was like the last thing you wanted to do in the morning, these morning briefings and telling people about what's new. But it looks like it paid off well. If our people felt that we supported them real time, that's a real wow, and congratulations for everyone on that. We have some time for a few questions if someone in the audience have them. So either put them at the chat or just open your mic and camera and ask. I think we have knocked everyone off. Anyone? So, without further ado, I would like to thank Cruz Roja Costarricense, Philippine Red Cross, Cruz Roja Mexicana, Kenya Red Cross, and my colleagues at Maguen David Adom, and especially Tamar Leist who is the person behind all this scene, and without him never would have happened. So first of all, thank you, Itamar. And thank you, national societies who agreed to participate in this event. And most importantly, thank you all our staff and volunteers who are on this call, webinar, and especially for all those who are not here, but are doing a great job on a daily basis. Thank you very much. Please stay safe. Take good care of yourself, of your team, and of your family. They are, at the end of the day, the most important ones. So please take good care, stay safe, and talk to you hopefully sooner than 1 year ahead of us. So, bye-bye.
Bye. Thank you,
Thank you very
everyone.
much.
Thank you all. Thank you.
Thank you.